Welcome to the show discussing problems and issues of health with Dr. Alcena. For this segment of the show, I'm going to continue to talk about COPD emphysema. COPD emphysema is a very, very common medical problem throughout the world. Exactly 600 million folks across the world have COPD emphysema. In this country, you have 12 million people who suffer from it, and there are another 12 million folks that are estimated yet to be diagnosed with this condition. It's a terrible, terrible condition. It causes a lot of people to die prematurely because of this particular problem. Worldwide, you have about, like I said, 2.74 million folks die every year from emphysema. And in this country, 120,000 people die every year because of emphysema, COPD. Very bad situation. People cannot breathe, and they're gasping for air. It predisposes them to infection. They develop pneumonia, acute bronchitis, and they decompensate, and they just die, and they suffer immensely in the process of with this disease. Now, you want to know, well, what are the things that cause someone to develop COPD emphysema? Well, of course, as you can well imagine, cigarettes smoking is on top of the list, followed by cigar smoking, air pollution, individual exposure to pollution, people who work in the coal mine, they have the coal mine lung disease. There is an abnormality called alpha-1 antitrypsin deficiency, which is responsible for 2% of folks with COPD emphysema in this country. Cystic fibrosis, people who work in the cotton, textile, wherever they process the cottons, these people inhale the material that comes out of the fiber that comes out of the cotton as they work in these mills. They wind up with emphysema as well. The same people who work in the sugarcane mill, as the sugarcane goes through the machine to squeeze the liquid out of it, the fibers get spread all over the air, and people inhale that over an extended period of time. They wind up with a COPD. Silica dust can cause it. Asbestos can cause it. The people who have recurrent pneumonia, for whatever reason, the underlying reason why they have the recurrent pneumonia, their lung becomes scarred after a while, and they can develop COPD, etc., etc. Now, I'm not here to do a show about cigarette smoking, but I need to highlight for you the danger that it represents and why it is so toxic to the lung. The cigarettes have about 4,000 chemicals in it, and 250 of those are very poisonous in terms of being able to cause cancer. They're carcinogenic. So this is really very serious stuff. And then you want to know, well, how many folks in the world smoke cigarettes? 1.3 billion exactly. And in this country, 42.1 million people smoke cigarettes. And cigarette is responsible for 480 deaths every year in this country, 480. It is a very serious problem, and worldwide, 6 million people die every year because of the effect of cigarette smoking. It is a terrible, terrible habit for one to have. And of course, once you get it, it's very, very difficult to get rid of it because it has the nicotine, which is an extremely addicting medication. People are struggling to get away from it, but they can't because they're addicted to the nicotine. In case you don't know, 5.5 trillion cigarettes are produced across the world every single year. Okay? Now, the reason why folks have such difficulty to get rid of the cigarette or the cigar or the pipe or whatever is when they stop it. This is the list of things that can happen. The craving for the nicotine causes anxiety, irritability, rapid heart rate, perspiration, elevated blood pressure, headache, fatigue, nausea, insomnia, difficulty concentrating, depression, weight gain, erectile dysfunction, infertility, etc., etc. So this is not something that one needs to get started on if you can help it. And these folks who sell cigarettes this is a free enterprise system. This is the United States of America. People are free to sell the product, but it is upon we really have a responsibility to label the product so that people have an idea what they're getting themselves into, because once you get started it's very difficult to get rid of. Again, I'm not here to say anything bad about folks who produce cigarettes or tobacco or whatever. This is a free enterprise system. I'm a capitalist myself. Folks are entitled to earn a living and produce whatever they think they can produce to make money. However, they have no right to make material that's causing people to suffer because of poor health. So they have a responsibility to label the product clearly and visibly so that people can have an idea what they're getting themselves into. And I'm sure the FDA is now actively involved in trying to regulate this industry as much as possible. That being said, now let's get back to COPD. What happens is that this massive amount of material that's in the tobacco, once it gets into the lung tissue and all the chemicals there, they develop an acute inflammatory reaction. Once you have an acute inflammatory reaction that occurs inside the tissues of the lung, subsequent to that, because of its chronic nature, it develops scarring, as it were. It becomes chronic. That damages the substance of the lung itself, so therefore air cannot be processed properly inside the lung. So when you take a breath, you breathe in, you should be able to circulate the air throughout the lung, and then when you exhale carbon dioxide very freely and easily. But when you have lung problems, by the way, there are many other things that cause lung problems. It's not just cigarettes and tobacco product. It's fair to say that. A lot of other stuff. But the one that can be prevented much more easily is this. I mean, come on, 5.5 trillion cigarettes are produced per year. 1.3 billion people smoke it across the world, and 42.1 million people smoke cigarettes in this country. It is a bad thing to get started. Unfortunately, sometimes people get started very early because of peer pressure, and as early as middle school and of course high school, and people started to join the crowd. They started smoking, and suddenly they find themselves unable to give it up. So once the damage occurs in the lung, then people develop difficulty breathing. There are two different types of COPD emphysema. You have the blue bloater are people who are usually they're a little heavyweight and type folks, and the symptoms are similar to asthmatic symptoms. And the people who have the pink puffer type of emphysema, if you want to call it dry emphysema, because they have difficulty bringing anything up, as opposed to the blue blooded, they cough up copious amount of secretion from the lung. The pink puffer cannot do that. It's dry. That's why they have, you see them there, the barrel chest, very thin, and they look, I suppose that's why the term pink puffer, because they're puffing, trying to get the air out. If as though you're pushing the air through a straw, they press the lips so that it can push the air out as much as possible and to try to bring it in. It's difficult. It is difficult. If you were to go to the morgue, I don't want to be graphic, go to the morgue and see what the lungs look like of someone who smoked, who died, it will scare the heck out of you, and you will never touch tobacco product again. It is not a sight that you want to see, and I've seen it. I've gone to the morgue. I've seen the situation where autopsies are being done. It is brutal to look at. So that's what happens. So the air cannot be exchanged, and the people are suffering, and because of that, they have multiple organs are affected as well. You have to understand that people who smoke have 4 times incidence of stroke, 4 times incidence of heart disease, and so on and so forth. And of course, you know about the cancer. I mean, the list. Let me list for you again. I did say that I wasn't going to talk about cigarette, but it's a fair thing. It's a fair thing to do, to show to you, to actually list for you the different type of cancer that thing can cause. It's a page and a half really, and I won't read all of it to you. Cancer of the lung, cancer of the esophagus, cancer of the larynx, cancer of the throat, cancer of the tongue, cancer of the neck, cancer of the tonsil, cancer of the pancreas, cancer of the bladder, cancer of the ureter, kidney, stomach, cervix, rectum, colon, leukemias. I mean, I can go on and on, all this horrible thing. I mean, as I said, I have a page and a half of things that cigarette can cause. The circulatory system get devastated, where people are losing their fingers, losing their toes, losing their legs because the circulation is damaged. They develop peripheral artery disease because of the effect of this garbage that's put in this tobacco, and they're just suffering tremendously. So now that you have an idea what COPD is and what happened to the lung, the symptoms of COPD, of course, I think I have a list of them here, as you can well imagine. It is, and I take this, I'm copying this from this book here, chapter 32, on this book, Health Status of African Americans. I just wrote this book. It came out maybe several months ago. Chapter 32 talks about COPD emphysema. You could find it in your local public libraries, and it will give you an idea of all the horrible things that can happen. And the symptoms, of course, as I just mentioned, is coughing, tiredness, headache, fatigue, insomnia, depression, infection, different types of infection of the upper airway, in particular infection of the lungs, such as acute bronchitis, where people have difficulty coughing. This yellowish or greenish secretion from the lungs is a horrible thing, and sometimes it's purulent. They're coughing that junk, and then of course COPD itself can cause a whole host of other complications of the lungs that I'm not going to bother you to mention. You could read them up in this chapter if you ever get your hands on it. It's not that difficult to get. The public libraries have it, and folks who are in the book selling business have it online. I'm not a commercial person. I just write books to make contributions, and I'm an academic doctor, and I write from the top of my head and things to try to make a contribution to society. That's the basis. This is my hobby. I'm not in the business of writing book to make money. You don't see me on television or commercial television promoting book. Whatever, these people, that's what they do, that's fine. I have nothing against that. That's just not, I barely have time to get enough sleep at night. Where do I have time to travel across the country to promote book? Give me a break. I can't go from here to Brooklyn before getting half a dozen calls to come back to White Plain because patients are in need of my help. In any event, people can't breathe. They develop, they look cyanotic because of lack of oxygen. Okay. Also, some of the side effect of that, as I just mentioned, is the upper airway infections. They're more likely to get it because, see, what it is that the lining of the upper airway all have cilia, with little hairy material there that catch debris as we breathe it in. Well, the heat from the cigarette, the cigar, the pipe, or whatever, it destroys that. So people who smoke, the entire upper airway from here, from the nose all the way down to the trachea, it's all naked, just sitting there to be devastated by stuff that they inhale because there's nothing to trap. The purpose of the cilia is to help you to trap garbage as we inhale them so that we could cough and throw it out. They don't have that. It's all destroyed. This is how they have the recurrent infection. The entire airway is there, completely exposed, that is, to anything that they're inhaling. So they get infection very easily. And then once they get infection, then pneumonia can develop. And they develop severe heart disease. And the heart disease, of course, can cause them to go into develop chest pain, have a heart attack, and they wind up with severe congestive heart failure. And they have this both sides of the heart fail. Why is that? Because when you have COPD emphysema, because of the obstructions that's involved in the circulatory process of the lung, they develop a condition called pulmonary hypertension. Now, the pulmonary hypertension damages the right side of the heart, the right ventricle. Once that's damaged, it will eventually fail. And because it's damaged, all through the process of its being damaged, it's not working properly. It's affecting the working of the left heart. And the left heart eventually will fail as well. So they have biventricular congestive heart failure. It's a very difficult thing to deal with, to treat. It's very tough. They have biventricular congestive heart failure. On top of that, the cigarette itself and the garbage that's in it cause damage to the coronary vessels, so they are 4 times more likely to have coronary artery disease. So there you go, chest pain, okay? Chest pain, okay? Followed by heart attack, and so on and so forth. And it makes it very, very, very difficult for them to live a normal, productive life. And that is why the whole process of COPD emphysema in this country cost the system $50 billion. 49.9 billion, $50 billion per year. That's what it takes to treat people with COPD emphysema, 50 billion. Okay, the healthcare system is a 2.7 trillion industry, and I'm just giving you a little bit of what happened. Okay, now if you add up to that the lack of productivity, the loss of productivity, it is maximized even more. It's a bad, bad, bad disease. Again, I'm making it absolutely clear. The list of things that can cause emphysema, COPD, is quite long. And I have enumerated them to you just because I talk about cigarette and tobacco and the terrible thing that they do to people's health. That is not to say that other things are free either. You know, there's not a free ticket. The other problem, because once you get COPD emphysema, there's not much matter how you got it. You got it. Okay, if you continue to smoke, it makes it worse. What's interesting about that, if you stop smoking, the damage to your lungs improves. Yeah. So it pays to stop. It's not easy, but it pays to stop. Okay, so enough said about cigarettes. So now that the patient will present to you, you have no idea what's going on. All he or she will tell you they're having difficulty breathing. How do you go about evaluating that? Well, you take a history, naturally, very important to know if they smoke, they drink alcohol, where do they work, very, very important to get the work history. Take the family history, because there is antitrypsin deficiency that is familial in nature. So you take a clear history from them, then you're going to proceed to examine them. You examine the patient with a complete, thorough physical examination, and then important point to remember, and this is for the younger physicians who are just starting to practice the business of clinical medicine, as well as those who are working in the ER. When you're examining a pink puffer patient, that is the people who have so-called dry emphysema, you have to keep in mind the sound of the heart changes location. That's very important, because I just mentioned to you that these people can go into heart failure. Well, one of the treatment we could do for someone, and we often do when they come in acute congestive heart failure, such as pulmonary edema, we might give them morphine, because the morphine is a vasodilator. We give them Lasix, oxygen, morphine. Time out. Because if you give morphine to somebody with COPD emphysema, they're going to die. They're going to stop breathing. That's right. Because they already have weakened muscles in the chest. They're having difficulty breathing. Then you give them a shot of morphine, you're going to cut up the respiratory system. How do you know that somebody has emphysema, COPD, that you haven't even done a chest x-ray on yet? You just take a history. Well, if they're a pink puffer, One of the trick of the trade, the heart shifted. If you're looking for the sound of the heart to be found here, right under the nipple, when you're examining the heart, you ain't going to find it there. You're not going to find it. It is shifted to here. You have to listen here. How about that? Because it's shifted all over here. That's a clue right there that patient ain't going to get morphine because the heart have shifted here. Patient have trouble breathing. That's a patient with emphysema. That's way before you even do a chest X-ray. If you miss that, let me repeat that. The heart shifted, so the sound that you will usually hear right beneath the nipple is shifted over here, right here. So that's where you listen for the first sound. That's when you realize, I'm dealing with somebody with right heart disease who's got pink puffer COPD. Sometimes you could tell by the way they look, but in the beginning of this disease, they may not look as emaciated as they would later on. It would be obvious that you're dealing with somebody with barrel chest who is very, very thin. They can hardly breathe. They have cursed hair like that. Their lips trying to breathe in and out. That's obvious. But it's not always that simple. So the key thing is that you're not going to give morphine to someone with COPD emphysema. That's the point I'm trying. In particular, the one that has the pink puffer syndrome. None whatsoever should be given as it relates to morphine. We have other ways of treating this congestive heart failure and modern medicine without pushing morphine on them. Okay, so the point to be made, therefore, you have got to learn how to examine patient properly at the bedside. I am happy to say that the medical community at large have finally awakened to the need to change the medical education system to bring people back to the bedside to learn how to examine patients and how to practice clinical medicine at the bedside, rather than teaching people how to pass exam so that they can call themselves an expert by just passing a board exam. It's a joke to think that just because you pass a board exam that makes you an expert. Give me a break. It takes a whole lot more than that to become an expert in the field of medicine than just pass. That's just the beginning, okay? So instead of teaching to help people to pass exam, yeah, they'll do that too, but now they're going back the old-fashioned way. The AMA and American College of Physicians and others are pushing this concept, and now, starting now, as a matter of fact, they just changed the MCAT exam as well to make it more relevant to daily living, to more common sense type thing, so that people can get into medical school. Okay, so they're doing that. So the change is coming. Thank God. I'm still alive to see it. Change is coming. As someone who have been challenged so many times, it will make you sick if I were to tell you how many times people who know 1 trillion less than I know, put in a position to challenge me, who know many more times. They will have to live 1 trillion years to know half of what I know, and yet the system put them in a position to challenge me, who was a professor of clinical medicine type 2. I'm a professor at New York Medical College. I'm a professor at Einstein Medical College. I earned these things, and you should see the fools, the idiots that they've sent to my office to try to test me out to see what I know. What a joke, okay? Instead of spending their time learning so that they can provide quality care for their patients whose responsibility they have to take care of, they're wasting their time paying attention to me, who was already so far ahead of them, they could never catch up, and yet they're still trying. This is how horrible racist people behave. In any event, they have to learn. So now that you've done your history, you've done your physical exam, now you're going to proceed to get yourself a chest X-ray. You get a chest X-ray. The chest X-ray of somebody who has COPD emphysema is very distinct. It trapped air. It has particular characteristic to it. The radiologists are best at that, obviously, but us who are internists can also tell this is COPD emphysema, okay? And then you look at different things. What are you looking for? Well, patient can't breathe. What's wrong there? Is there fluid in the lung? Is there infiltrated? The pneumonia there? Do they have a mass? there's something else going on into the lung, why they cannot breathe. Do they have a pneumothorax or God won't know, whatever. Then you will proceed to do an arterial blood gas. The arterial blood gas is very important. It tells you about the oxygen concentration. It tells you about the COPD concentration, blah, 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 blah. So you do an arterial blood gas. That tells you if the patient is in need of oxygen or not, and if so, how much. Very, very important. So you do on that. And then before we even go further, you will do this test right here. This is a peak flow meter. This is a peak flow meter. The peak flow is very important. Everybody with COPD emphysema ought to have one of these things. They ought to have one because it helps them to know once they use it, they breathe in it, they know what's the baseline, the best that they can do in terms of expiratory flow, and they keep track of it. They keep a log of it. And when they're feeling bad, they're having a bad day, then they use it again, and when they can't match what they've done the day before, they know they're in trouble. So they head toward the ER. So in the emergency room, we give them that to do as soon as they showed up. Then we take a note of it, then we could tell how bad they are. They're not doing. The asthmatic use it, and they use it as well. And now that we've examined the patient, we've got a chest x-ray, got a blood gas, we give them some oxygen. Now we're going to have to try to help them by giving them medications that's going to help them to bronchodilate the bronchioles inside the lung so that the secretion get trapped there, can be liquefied so they can cough it out. Because the inflammatory process that the secretions are causing also called spasm. So we give them medication that relaxes the bronchioles so that they can cough it up. And of course, we will proceed to give them the whole standby, which is steroid. Can't treat them without steroid. And when I do the next show, I will explain more on how steroid works, why it is such a necessary medication in the treatment of COPD emphysema. Listen, I'm going to stop here. Until I see you again, this is Dr. Alcena saying so long and bye-bye.